For more, I'm joined by Andrew Noymer. He's an associate professor of population health and disease prevention, public health at the University of California, Irvine. Andrew, thanks so much for joining us. First, are you surprised by these numbers? Do they make sense to you?
Thank you for having me on your show. Well, these numbers don't make sense in a logical framework, but it is a continuation of patterns we have seen in the recent past with parents leery about the measles vaccination for their children, for example. So it's a continuation of a trend, unfortunately.
What are some of the reasons behind skepticism, and how might those vary by country or even different cultures within those countries?
Well, I mean, people point to a now discredited study about the linkage between autism and vaccination for children, but I think it goes deeper than that. I think it's just it's a modern day Luddism. It's a suspicion of technology and a kind of a rejection of authorities. If the government wants us to get vaccinated, we're going to do the opposite.
I want to give the example of Israel. It was addressed earlier. We've seen variations in the communities, in the ultra-Orthodox community versus the secular community, in the Arab community versus Jewish communities. In areas where there's been a higher rate of transmission, there also appears to be some higher skepticism of the vaccine. Are you seeing that trend elsewhere in the world?
Well, we don't have as much data in the world at large as we do from Israel, but it's certainly worrisome that, one of the arguments that's been presented is when people see how horrible the disease is, that they will, be more open to getting vaccinated. But we're not seeing that. I mean, in the United States, here in Southern California, we're very hard hit at present with the COVID, and we're not seeing a lot of openness to vaccination among the usual people who are suspicious. So it's really distressing. I mean, the argument was that when people see the disease, they'll want the vaccine, even if they didn't want it before. But now it's not so clear.
One of the hardest hit communities in the U.S. has been the African American community, and there's been a specific outreach in the U.S. targeting Black Americans. Why is that so important, and is it working?
Yeah, there's definitely been an outreach. The Surgeon General of the United States, who is Black, who was vaccinated, and he's been doing a lot of work. The thing is, in the past, the medical establishment and the African American community has a very kind of mixed track record of trust building, going back to the most egregious example that is well known is the Tuskegee experiment, in which syphilis went untreated in African Americans in order to study it in the long term, even after a cure was invented. So, there's a lot of history there, and a lot of cases where the trust hasn't been earned, and unfortunately that's carried forward to the 21st century. Indeed,
not just Tuskegee, Henrietta Lacks, and others, of course, instances of that mistrust, understandable mistrust. Andrew, finally, what are the consequences if not enough people get vaccinated?
The vaccine works best when we all get it. We've heard so much about herd immunity, and herd immunity is when the pandemic starts to come off the boil because so many people are immune, and the virus has a problem jumping from person to person to person because so many of the people are already immune. But the best way to get to herd immunity is not from a rampant pandemic, but from vaccination. And so it's really going to make a bigger difference if we can all get it when it's available for all of us than if 20% or more people opt out. And so it's just really important to spread the message that this vaccine is safe and effective. And it's really quite effective. And I'm looking forward to getting mine, I must say.
You might have to wait a while, though. You look like a young, healthy man there.
Thank you.
Andrew Noymer from the University of California, Irvine, thank you for joining us.
Thank you very much for having me.